Okay, let's drain the face with the lymphatic drainage manual. We're always going to open up the termini, which is right by the collarbone. So you're going to do about 20, 30, 40 strokes. I like to call them swim strokes, and then I like to do a little bit of a push down motion. And then we're going to go to the apical. And notice this is about double speed. So you're going to go a little bit less speed than this, but that's going to drain the arms. Then I'm going to go into the armpits, and I'm just going to swim in the armpits again, bringing everything towards the midline. That way, any of the arm buildup can be released. And then I'm going to go into the fourth spot, which is the sternochyli. So I'm going to drop right into that rib cage area. And you can just have the client do 10 breaths. But what I'm having her do is just a little bit more of a following the breath up, following it down, and then a slight push down. I'm going to do 5 of those. That's going to open up the sternochyli, I believe, the best way. But again, just doing 10 belly breaths is also going to be amazing for this. Following it up, following it down, and then a slight push down. After she does 5 of those breaths, I'm going to now go follow it up, follow it down, and I'm going to push up towards her heart or towards the thoracic duct. And I do 3 of those, so 5 and 3. So that was 1, 2, 3, 4. Now we're going to go to the 5th. We're going to go to the pre and the post auricular. And notice it's almost like a V you can create. And it's right by the ear, in front of the ear and behind the ear. And I'm just opening that up. Now I'm going to go into the tonsillar lymph area. So that's right below the ear lobe. And then I'm going to go into the mandibular lymph area, right below the chin, the premental. And then lastly, I'm going to go to the hairline behind where there's occipital lymph nodes. And I'm going to draw, all of this is going to go into almost like the cervical and deep cervical lymph area. And then I'm going to finish just doing some termini, 20 or so. And I'm just sitting here giving you guys again all the spots. There was 9 spots, I believe. Now everything is open. I've opened all the channels, opened all the doors. And now I can do my massage strokes across the chest, creating some circular motions, just retracing. Just knowing that all the lymph goes through that cervical area into the termini, going under the jawline. And I'm just giving some little, I call them like little pat strokes, and finishing the strokes through the neck into the termini to let it know where to go. Going into the center, bringing that area through the premental down. This is such a relaxing treatment. This can be done without oil and then traced again with oil. That's the best way to do it so that you don't have too much of a glide at first. And then I'm just going into the TMJ area and I'm just relaxing that area. Going through. I like to use some of the sinus points as well. Everything is so connected. Giving some painting strokes through. So again, go ahead and do this without lotion or oil first, and then do it with oil or lotion to complete And this could be done in a 30-minute, or if you wanted to do it in an hour treatment, you could absolutely do that. And then just add in some nice strokes. Going into the occipital area. Relaxing the neck. My goal is always to make this a relaxing lymphatic treatment as well.